NHS's proud 72-year history. And the health and care system as a whole has risen in the face of great difficulties. And throughout, people have done incredible things and worked in novel and remarkable ways to deliver for patients. And we in this House salute them all. Not just the nurse who may have had to care for 2 or 3 or 4 times as many patients as he would in normal times. Not just the surgeon who may have been called to treat patients beyond her normal specialism, but the managers across health and care who've come together in teams as part of a health family at local and national level, the public health experts who've been needed more than ever before, the local authority staff who've embraced change to deliver for their residents, and from all, a sense of teamwork that has been inspiring to see. As a citizen, I care deeply for the whole health and care family, for the values they stand for, and the security they represent. They're there for us at the best of times, and they're there for us at the worst of times. As Health Secretary, I see it as my role, sometimes to challenge, but most of all, to support the health and care family in their defining mission of improving the health of the nation and for caring for those most in need. I come before the House to present this white paper based firmly on those values, which I believe are the values our whole nation holds dear. The white paper is built on more than 2 years of work with the NHS, local councils and the public. At its heart, this white paper enables greater integration, reduces bureaucracy, and supports the way that the NHS and social care work when they work at their best together. It strengthens accountability to this House, and crucially, it takes the lessons we've learned in this pandemic of how the system can rise to meet huge challenges and frames a legislative basis to support that effort. My job as Health Secretary is to make the system work for those who work in the system, to free up, to empower, to harness the mission-driven capability of team health and care, and the goal of this white paper is to allow that to happen. Mr. Speaker, before turning to the core measures, I want to answer 2 questions that I know have been on people's minds. First, are these changes needed? Even before the pandemic, it was clear reform was needed to update the law, to improve how the NHS operates and reduce bureaucracy. Local government and the NHS have told us they want to work together to improve health outcomes for residents. Clinicians have told us they want to do more than just treat conditions. They want to address the factors that determine people's health and prevent illness in the first place. And all parts of the system told us they want to embrace modern technology, to innovate, to join up, to share data, to serve people, and ultimately to be trusted to get on and do all of that, so they can improve patient care and save lives. And we've listened, and these changes reflect what our health and care family have been asking for, building on the NHS's own long-term plan. The second question, why now? Now as we tackle the biggest public health emergency in modern history. The response to COVID-19 has, in my view, accelerated the pace of collaboration across health and social care, showing what we can do when we work together flexibly, adopting new technology focused on the needs of the patient, and setting aside bureaucratic rules. The pandemic has also brought home the importance of preventing ill health in the first place by tackling obesity and taking steps like fluoridation that will improve the health of the nation. The pandemic has made the changes in this white paper more, not less, urgent, and it is our role in Parliament to make the legislative changes that are needed. There is no better time than now. Mr. Speaker, turning to the measures in detail, the first set of measures promote integration between different parts of the health and care system and put the focus of health funding on the health of the population, not just the health of patients. Health and care have always been part of the same ecosystem. With an ageing population, with more complex needs, that's never been more true. And these proposals, Mr. Speaker, will make it easier for clinicians, for carers and public health experts to achieve what they already work hard to do, to operate seamlessly across health and care without being split into artificial silos that keep them apart. The new approach is based on the concept of population health. A statutory integrated care system will be responsible in each part of England for the funding to support the health of their area. They will provide not just for the treatments that are needed, but support people to stay healthy in the first place. In some parts of the country, ICSs are already showing the way, and they will be accountable for outcomes of the health of the population and be held to account by the Care Quality Commission. Our goal is to integrate decision-making at a local level between the NHS and local authorities as much as is practically possible, and ensure decisions about local health can be taken as locally as possible. Next, Mr. Speaker, we'll use legislation to remove bureaucracy that makes sensible decision-making harder, so freeing up the system to innovate and to embrace technology as a better platform to support staff and patient care. Our proposals preserve the division between funding decisions and provision of care, which has been the cornerstone of efforts to ensure the best value for taxpayers for over 30 years. But we're setting out a more joined-up approach built on collaborative relationships so that more strategic decisions can be taken to shape health and care for decades to come. At its heart, it's about population health, using the collective resources of the local system, the NHS, local authorities, the voluntary sector and others to improve the health of the area. Finally, Mr. Speaker, the White Paper will ensure a system that is accountable. Ministers have rightly always been accountable to this House for the performance of the NHS and always will. Clinical decisions should always be independent, but when the NHS is the public's top domestic priority, with over £140 billion of taxpayers' money spent each year, and when the quality of our healthcare matters to every single citizen and every single one of our constituents, Mr. Speaker, of course the NHS must be accountable to ministers, ministers accountable to Parliament, and Parliament accountable to the people we all serve. Medical matters are matters for ministers. The White Paper provides a statutory basis for unified national leadership of the NHS, merging three bodies that legally oversee the NHS into one as NHS England. NHS England will have clinical and day-to-day operational independence, but the Secretary of State will be empowered to set direction for the NHS and intervene where necessary. This White Paper can give the public confidence that the system will truly work together to respond to their needs. Mr. Speaker, these legislative measures support reforms already underway in the NHS, and they should be seen in the context of those broader reforms. And they're by no means the full extent of our ambition for the nation's health. As we continue to tackle this pandemic, we will also bring forward changes in social care, public health, and mental health services. We're committed to the reform of adult social care, and we will bring forward proposals this year. The public health interventions outlined in this White Paper sit alongside our proposals to strengthen the public health system, including the creation of the National Institute for Health Protection. And last month, in our Mental Health White Paper, we committed to bringing forward legislation to update the Mental Health Act for the 21st century. Mr. Speaker, this landmark White Paper builds on what colleagues in health and care have told us, and we will continue that engagement in the weeks ahead. It builds on more than that. It builds on this party's commitment to the NHS from the very beginning. And eagle-eyed visitors to my office in Victoria Street will have noticed the portrait of Sir Henry Willing, who published the White Paper in 1944 from this dispatch box that set out plans for a national health service that was later implemented by post-war governments. Throughout its proud 72-year history, successive governments have believed in our health and social care system and strengthened it for their times. I believe the NHS is the finest health service in the world. I believe in the values that underpin it, that we all share responsibility for the health of one another. Its extraordinary feats this past year are unsurpassed even if in its own proud history. And once again, we must support the NHS and the whole health and care system with a legislative framework fit for our times and fit for the future. A more integrated, more innovative and more responsive system, harnessing the best of modern technology and supporting the vocation and dedication of those who work in it. This white paper is the next step in that noble endeavour, and I commend this statement to the House.
The Shadow Secretary of State, Jonathan Ashworth, with 5 minutes.
Thank you, Mr. Speaker. I thank the Secretary of State for advance sight of his statement, and I suppose we should thank Andy Cowper for advance sight of the white paper as well. Now, we are in the middle of the biggest public health crisis our NHS has ever faced. Staff on the front line are exhausted, underpaid. The Royal College of Nurses says the NHS is on its knees. Primary care and CCG staff are vaccinating and will be doing so for months ahead, including possibly delivering booster jabs in the autumn. And today we learn that 224,000 people are waiting over 12 months for treatment. And this Secretary of State thinks this is the right moment for a structural reorganisation of the NHS. Now, we will study the legislation carefully when published, but the test of this reorganisation will be whether it brings waiting lists and times down, widens access, especially for mental health care, drives up cancer survival rates and improves population health. Now, of course, we are not surprised he has ended up here. We warned ministers not to go ahead with the Cameron-Lansley changes 10 years ago. A reorganisation so big you could see it from space. It cost millions. It demoralised staff. It ushered in a decade of wasted opportunity. And of course, he voted for them. He defended them in this chamber. So I hope when he stands up, he will tell us he was wrong to support them then. Now, we have long argued for more integrated care. But how will these new structures be governed? How will they be accountable to local people? How will financial priorities be set? Because when something goes wrong, as tragically sometimes it does go wrong in the delivery of care, or when there are financial problems, like we've seen at Leicester's Trust, where does the buck stop? Now, he is proposing an integrated care board tasked with commissioning, but without powers to direct foundation trusts, which spends around 80 billion and employs around 800,000 staff. So he's suggesting a joint committee of the ICS and providers as well. But who controls the money? Because that's where power flows from. And both of these committees will overlap with a new third additional committee, the Integrated Care System Health and Care Partnership, which includes local authorities, Health Watch, and even permits the private sector to sit on it. All these committees must have regard for the local health and wellbeing board plans as well. So how will they avoid clashing agendas, lack of trust between partners, as we've seen at the ICS in Bedfordshire and Luton, for example? Because nobody wants to see integrated care structures which can't even integrate themselves. And legislation alone, of course, is not the answer to integration. We need a long-term funded workforce plan. We've not got one. We need a long-term cross-governmental health inequalities plan. We've not got one. And we need a sustainable social care plan. We were promised one on the steps of Downing Street. We still don't have one. Now, when he voted for the Cameron reorganisation 10 years ago, it was because he wanted, I presume, in the words of the white paper at the time, to liberate the NHS. But now he's proposing a power grab that was never consulted on by the NHS. It seems he wants every dropped bed plan to reverberate around Whitehall again. And he's announcing this just at the very moment the NHS is successfully delivering vaccination. In striking contrast to delivery of test and trace to PPE early on, where he was responsible. So again, we will look carefully at the legislation. But why is he so keen for these new powers? Why is he repealing his responsibility to set an annual mandate and bring it to Parliament? He wants to intervene now in hospital reconfiguration plans, but why is he stripping local authorities of their power to refer controversial plans to him? And with his new powers, will he reverse outsourcing? Will he end the transfer of staff to subcos? Will he bring contracts back in-house and block more outsourcing in the future? He is ditching the competition framework for the tendering of local services while potentially replacing it with institutionalised cronyism at the top instead. And fundamentally, how will this reorganisation and power grab improve patient care? He didn't mention waiting times in his statement. It's mentioned once in the leaked white paper. So how will he bring waiting lists down? How will he improve cancer survival rates and widen access to mental health care, and by when? How will his reorganisation narrow widening health inequalities, and by when? And given the Prime Minister insists lessons can't be learnt from this pandemic until the crisis is over, why does he disagree with that and consider this reorganisation so urgent now?
Well, Mr. Speaker, I'll take that as cautious support. I know that he sometimes has to say these things, but I'm very glad that the honourable gentleman leaves the door open for yet more enthusiastic support in the future, not least because of all the questions that he just asked. The proposals on the table, the proposals in this white paper, are addressed directly to make the improvements that he calls for. He raised the point about the vaccination programme, and this is an important point. The vaccination programme is one of the largest and also one of the most successful civilian operations that has happened in this country. And it's because of the teamwork between the NHS and local authorities and the department and the brilliant civil servants who work in the vaccine task force. It is this combination and this teamwork and this integration that is making it the great success that it is. And so he asks about timing, and I say to him, why argue for delay? Why stop work to integrate? Why stop work to make sure the NHS is more accountable? And when people are working so hard in the NHS for us, why should we not work hard in this Parliament to give them the legislative support they need and that they have asked for? That is the question that he needs to answer if he wants to continue an argument for delay. If not now, when? There is no better time than immediately. So I hope that he will, on reflection and upon reading the white paper, come forward with enthusiastic support. I absolutely look forward to debates about the details and the implementation. I look forward to a parliamentary passage of a significant piece of legislation in the future, and I look forward to his engagement on that. But the removal of bureaucratic barriers can't wait. The increase in the integration of the system shouldn't have to wait. And the accountability for this enormous amount of taxpayers' money to this House and through this House to the citizens who we serve, that is something that I think should be welcomed right across this Parliament, and I hope that it will.
Let's head to the Chair of the Select Committee, Jeremy Hunt. Jeremy.
Thank you, Mr. Speaker, and can I start my comments by thanking the brilliant staff of the Royal Surrey County Hospital for the wonderful care they gave me this morning, as it happens, when I unfortunately slipped over and broke my arm on a morning run, and I've just come back from there. It is a very big deal to do a structural reorganisation of the NHS, and I know from my time as Health Secretary how distracting it can be. But it is nonetheless the right thing to do and a brave thing to do, because NHS staff want nothing more than to be able to give joined up care, joined up between hospitals, GP surgeries, the social care system, community care. And the current structures make that more difficult than it should be. I also welcome the public health measures, particularly on obesity, given the high mortality rates that obese people have had during the pandemic. But these integrated care systems are going to be very powerful. So my question to the Health Secretary is, how will the public know in their area if the quality, the safety of care, if the waiting lists are being properly managed? How will they know how good all that is? Is he planning to ask the CQC to do Ofsted ratings, as they successfully do for hospitals and GP surgeries?
Thank you very much, Mr. Speaker, and I pay tribute to my predecessor's work setting up integrated care systems in the first place. And in a way, this legislation builds on those foundations that he built when he was in my job. And I look forward to working with the Select Committee on this legislation as it comes forward, as indeed we already have in discussions so far, and I'm very grateful to the work so far of the Select Committee and the insights that they've provided. The question that he raises about the accountability of ICSs is absolutely central, not just to accountability for taxpayers' money, but also to the driving up of quality of care, not just care for patients, but critically the health of the population who they serve, and ensuring the correct combination of high levels of transparency, along with the role of the CQC as inspector, and then accountability up from the ICS through NHS England to ministers, and therefore to Parliament, and through Parliament, through our democratic processes, to taxpayers. That accountability is critical. The white paper sets out in high levels how that accountability will work. The details will, of course, be a matter for the bill, but the combination of transparency and clear lines of accountability are incredibly important to make sure that whilst we use the integration that is provided for in this bill to empower frontline staff on the ground to deliver care better, so too they are held to account for the delivery of that care and critically the outcomes for the population as a whole who we serve.
Video link. For 2 minutes, Dr. Philippa Whitford.
Thank you very much, Mr. Deputy Speaker. Health and social care staff always do their best for their patients and residents, regardless of legislative systems. But I welcome that the government has recognised the damage caused to the NHS in England by the Health and Social Care Act and proposed to reverse some of its most obstructive and expensive aspects. In particular, Section 75, which forced the outsourcing of services, promoted competition instead of collaboration, and made pathways more disjointed and confusing for patients, particularly those with complex conditions. The devil, however, will indeed be in the detail. So which model of integrated care systems is the Secretary of State proposing? Merging existing organisations, including commissioning groups, or as the NHS would prefer, creating them as new public NHS bodies, similar to the health boards we have in Scotland? When sustainability and transformation partnerships were created, their transformation budgets were quickly used up to cover debts caused by the bureaucracy of the healthcare market. So what additional funding is he committing to bring about this reorganisation? With the pressure of COVID, the backlog of urgent cases and extensive staff vacancies, how does he plan to create the capacity for staff to carry out such service change? COVID has highlighted the vulnerability of the care system. So what plans are there to integrate health and social care? And finally, he has highlighted health inequalities, but poverty is the biggest driver of ill health. So what discussions has he had with the Pensions Secretary and other cabinet colleagues about promoting the prioritisation of health in all policy decisions?
Thank you very much, Mr. Deputy Speaker. Well, of course, health is an important consideration in all policy decisions, and I think the overall response to the pandemic has demonstrated that. On the specific questions that she raises, she's right to raise the issue of integration, and she asks what plans there are for the integration of health and social care. Indeed, that is at the core of the proposals, as I set out very clearly in the speech, and as is there at the core of the white paper. The integration of health and social care has significantly improved this year as a result of what people have had to do to work together in the pandemic. Fundamentally, social care is accountable to local authorities who pay for it and therefore to the local taxpayer, whereas the NHS is accountable to central government, to ministers and central government. And therefore, the combination of these two vital public services is a challenge that I think can be addressed through the integrated care systems, and we've been working very closely with the LGA in England and the NHS to try to effect that integration as much as is possible. She raises the issue of funding, Mr. Deputy Speaker. Of course, the NHS has record funding, and rightly so right now, But these reforms are about spending that money better to improve the health of the population and to allow the embrace of new technology and to remove bureaucracy. It isn't about having to spend more money on a reform. It's about reforming in order to spend money as well as possible.
Colonel Bob Stewart.
Thank you, Mr. Deputy Speaker. My right honourable friend, when I was in the army, I was badly hurt, and I was put under the care of the NHS, that in turn sent me to a private practitioner, actually in Harley Street, who did me the world of good, and I paid nothing. Now, as an MP, I'm frequently asked, is the government intending to privatise the NHS? And my reply is no, of course it's not, and very little of the NHS is privatised. So could I ask my right honourable friend to inform me how much of the NHS is currently privatised as a percentage and what the plans are to increase it or not?
Mr. Deputy Speaker, the NHS is not privatised at all. The NHS is delivered free at the point of care, free at the point of use, according to need, not ability to pay. Now, of course, the NHS buys all sorts of things. It buys goods, it buys services, it buys technology, it buys scalpels, it buys services of different scale and sizes, and it employs people. And this combination is essentially what the NHS is made up of. Now, it matters not the name of the provision. What matters is the care for the patients and the quality of support for population health. And the pandemic has demonstrated how what matters is the outcomes, and the coming together of different types of provision has always contributed, as my honourable friend set out, has always contributed to the delivery of care to patients, and that will no doubt happen for all of the time, for the entire future of the NHS, which I have absolutely no doubt will be going from strength to strength, not just over the last 72 years, but for the next 72 years and after that.
Video link. Barry Shearman.
Thank you, Madam Speaker. Could I say to the Secretary of State, is he aware that I'm fully in favour of a review of the NHS that brings it up to date and makes it the best health care centre in the world? But is he also aware that if he wants to make it a milestone, surely he should slow down a bit? Why not consult across party? Why at this unique time when we've all been in this together, why can't he consult more? Why doesn't he listen to the people and consult with the people who work in the NHS as well as the people who've benefited from the NHS? Why rush this? Why not talk about it, get cross-party support? Politics of all kinds have never, ever got the NHS absolutely right. Why not work together across the party lines, consult with the people that work in the NHS and benefit from the NHS? Slow down, Minister, and you get me on your side.
Thank you very much, Mr. Deputy Speaker. I very much hope to get the Honourable Gentleman on side and supporting these reforms. Not least, many of them were in not just the Conservative Party manifesto, but also the Labour Party manifesto on which he stood. We have consulted extensively on the measures in this set of reforms over 2 years. And I now look forward to further work, consultation, discussion with parliamentarians on all sides before, during, and no doubt then after the passage of the bill. It is an incredibly important piece of work. What I don't want to do is delay the improvements that people on the front line themselves have called for. The core measures of this bill have been built on the asks of the NHS itself and working with local government. And I think we should get on and deliver them.
Anthony Higginbottom.
Thank you, Mr Deputy Speaker, and can I give my overwhelming support to these proposals, particularly the drive for innovation and technology, which will improve not only access to care, but the outcomes of care for patients too. The Secretary of State will be aware that in Burnley Hospital we already have some advanced surgical robots that perform incredible care. Could I urge him to look as part of these reforms at how we can use sites like Burnley Hospital to become regional centres of excellence in areas like surgical robotics?
Yes, Mr Deputy Speaker, and we care about technology in the NHS because we care about people and the improvement to people's lives that it can generate. And surgical robots is just one example. I'm very glad to hear that they're being used in such an innovative way in Burnley Hospital. I'd love to come and see that for myself one time. And this is exactly the sort of progress that the NHS should be making to free up the time of the dedicated and highly skilled clinicians and to be able to deliver more high quality surgery because of, for instance, the higher magnification that you can get in the use of a robot for surgery. So it's just one example of the sort of thing that we can push further as a result of the measures in this white paper.
And when you come to Burnley Secretary of State, of course, there's Ribble Valley, there's Chorley. I know there's a few other places you're going to put onto your list. Video link, Tony Lloyd.
Thank you, Mr Deputy Speaker. The Secretary of State may be aware that before I returned to Parliament, I had some involvement with the establishment of the Greater Manchester model of health and social care. And can I offer in two insights into that? And the first of those clearly is that social care is not yet funded in the way that we need if we are to have that proper integration. But the second one is that it was possible to have a Greater Manchester strategic level for the near 3 million people of the conurbation, but to have integration and delivery at the district level. Will he guarantee that with the integrated care systems that there will be nothing that prevents the very successful model that Greater Manchester is already pioneering?
Yes, I think that the changes in Greater Manchester, which he had an important role, are a good example of where we can drive this sort of integration. I can confirm that there's nothing that I'm proposing that would get in the way of that. In fact, I would hope that the changes in this white paper will help areas like Greater Manchester that are already some way down this journey to go further and support them with fewer legislative barriers to the sorts of actions that they want to take. And that includes both the measures across the NHS and the integration between health and social care.
Video link, Danny Kruger.
Thank you, Mr Deputy Speaker. Frontline health and social care providers have shown enormous flexibility, innovation and collaboration in dealing with this crisis. I welcome the Secretary of State's proposals, and I'm particularly pleased he has stressed the need for both clear political accountability and strong local autonomy for the front line. Will my right honourable friend assure me he doesn't want to hear the sound of dropped bedpans from his office in Whitehall, as Nye Bevan did, rather that we need a more local, more collaborative, more community-led approach to social health and social care, like the Conservative Henry Willink did, as he says, the original designer of the NHS.
Yes, it's absolutely right. And in fact, my honourable friend put it rather better than I put it. And maybe I'll take up his suggestions, his rhetorical suggestions for how to make this case, which is that the accountability is important, but the more local decision making, the better, and that is local decision making across a whole range of partners, not just the core NHS, but providers of services from whatever sector they come, including the voluntary sector, who have been more embraced than before during this pandemic, and we need to build on that further to make sure that we have a system that can truly serve the local needs, because ultimately all healthcare is locally delivered because it is delivered to an individual to improve and save their life. And we need to make sure that the appropriate decisions are taken essentially at as local a level as reasonably possible.
Video link, Farrell Clark.
Thank you, Mr Speaker. Mr. Speaker, the pandemic has shone a light on massive health inequalities across the country. The Secretary of State announced the abolition of Public Health England in September, and there is still no clarity on where the vital health improvement function will sit in future. Why are we hearing about new structures for the NHS today without also getting clarity on the arrangements for vital elements of public health and prevention?
There's a simple, clear reason for that, and I'm very glad that she asked that question because it is an incredibly important function. We will be setting out more details on the arrangements for health improvement functions, but the population health approach that is embedded within these integrated care systems set out in this white paper will themselves be at the fulcrum of delivery of health improvement and of narrowing health inequalities. Because if you think about it, around 20% of the impact on somebody's health is what happens in hospital. The rest is what happens outside of hospital and the extra support that people can get, and of course the choices that people make. And integrated care systems will be supported and funded in such a way that their goal is to improve the health of the local population, not just the patients. So health improvement is embedded in the structure and the design of the future of the NHS, embedded in this white paper. And the wider health improvement responsibilities will then flow from that. And we'll set out the precise organisational structure of those shortly, but I needed to get the white paper out first because it is off this population health approach that the future of health improvement will be built.
Audio link. Anne-Marie Morris.
Thank you. I welcome the commitment to more joined-up care, which must include mental health. The Health and Social Care Act of 2012 committed to parity of esteem between physical and mental health. Could the Secretary of State set out how this white paper specifically builds on this and whether it requires and will measure parity of esteem in terms of output and particularly outcomes for mental health? If not, why not?
Thank you. I'm grateful for my honourable friend's support. The parity of esteem between mental and physical health is absolutely critical, and of course is embedded in a population health approach. So it is critical that the new integrated care systems will of course have responsibilities for provision of mental health services as well as physical health services, and the historic silo between the provision of mental health and physical health services needs to be brought together, because so often the provision of both is critical in a world in which many people have multi-morbidities, including challenges with both their physical and their mental health.
Jim Shannon.
Deputy Speaker, can I thank the Secretary of State for his statement and for announcing a progressive strategy which we all welcome. Does the Secretary of State not agree that this pandemic has opened our eyes to the gaps in frontline service provision, that nothing else could have been done, that we must ensure that nothing is able to prevent basic cancer treatment taking place moving forward? And having spoken recently to someone in the midst of a cancer battle, they say they've been trying to fight with one hand tied behind their back. And can I ask how the Secretary of State will ensure that patients awaiting scans and treatment plans are able to safely access them? Thank you.
Yes, of course. The figures out today, in fact, demonstrate the scale of the challenge when it comes to cancer treatment. And the pandemic has had a challenging impact on cancer treatment. Of course it has. We're supporting cancer alliances to improve the outcomes as much as is possible, and to work through the backlog that has inevitably built up because of the pandemic. Cancer alliances are a very important part of the future of the delivery of care, and in many cases they will be bigger geographically than an ICS. For them and for other specialist treatments, of course, in some cases, that will have to be at a larger scale than than an ICS. But alongside putting these reforms in place, we absolutely are determined to do everything we can to ensure people get the treatment for cancer that they need as soon as possible.
Video link. Steve Brine.
Thank you, Mr. Deputy Speaker. I welcome the white paper very much. I would urge my right honourable friend to think workforce, though, at every stage, but to ensure prevention is the golden thread which runs through all future legislation and plans. Given the last 12 months has very much laid bare the impact of inequalities on our public health outcomes, will we be truly bold and return to our prevention green paper, which the Secretary of State knows well, when it comes to facing the obesity crisis, smoking prevalence, alcoholism, diabetes and stroke prevention, just to name a few?
Yes, there are measures in this white paper that precisely pick up the work of the Prevention Green Paper that he did so much in shaping when he was in the department with me. And in fact, many of the proposals in this white paper are built from conversations that he and I shared. And I want to put on my record my gratitude to the work that my honourable friend did in shaping this agenda, because ultimately a population health agenda is an agenda about the prevention of ill health. Of course, we must and we will treat those who become ill, but it is far better for everybody to support people to take a shared responsibility, including their own personal responsibility, to stay healthy in the first place. And the population health agenda that will be at the heart of the integrated care systems is ultimately a preventative agenda, and one that I'm very glad to hear he supports so wholeheartedly.
Video link. Munira Wilson.
Thank you, Mr. Deputy Speaker. On this day 8 years ago, the government announced and then legislated for a new funding model for social care, which the Tories then scrapped 2 years later. 8 years on, we have yet another NHS reform announcement and only yet another promise to reform social care. With 25,000 care home deaths during this pandemic, what will it take for the Prime Minister to make good on his promise to fix social care? And when will the Secretary of State start the long-promised cross-party talks to find a solution?
Well, Mr. Deputy Speaker, on the contrary, this white paper is a white paper covering health and care. It covers the integration of the NHS and social care at a local level. Of course, there's further work also on funding, as we've committed to in our manifesto. But the integration of those services, which has been so important in the pandemic, is one of the critical pieces of the health and care bill that's forthcoming.
Video link. Bob Seeley.
Thank you, Mr. Deputy Speaker. I congratulate the Minister on this very important plan and announcement today. The island, as he knows, is already piloting some ideas, so thank you to his team of excellent advisors and to the Minister himself. But can we have more pilot schemes to support his work? As he knows, the benefit of his approach may be felt more strongly on the Isle of Wight than anywhere else in Britain, due to our excellent but unavoidably small hospital at St Mary's, the smallest county council in England, and our age profile. So we want to help him, and we want to be at the front of the queue. Will he also consider the position, please, of the 12 unavoidably small hospitals in England as part of this programme, of which St Mary's is the most unique because it's on an island? But thank you to his team and to the Minister for his great work.
Thank you very much. With an ask like that, I think it's very hard to say anything other than yes, enthusiastically. I'm keen to work with my honourable friend, who is such an incredible voice for the Isle of Wight. And the services on the Isle of Wight, by its island nature, are more closely aligned together than in many other parts of the country. But nevertheless suffer from some of the bureaucratic silo requirements in current legislation. And I hope that these proposals will be received enthusiastically by all those involved in the provision of health and social care on the Isle of Wight, and indeed public health, because they will remove the legislative barriers to closer integration and allow them to continue in the direction that I know that they're enthusiastically working with my honourable friend's support.
Video link. Derek Twigg.
Thank you, Mr. Deputy Speaker. In the middle of a pandemic, its implications for future healthcare are still not yet fully understood. And when NHS staff are exhausted with no respite on the horizon, there are real concerns that the Secretary of State is embarking on this reorganisation now. So how will these plans specifically address the lengthening backlog of cancer treatments in Halton and the North West? And how will replacing local decision-making by what will be large sub-regional health bodies allow greater local accountability and encourage local innovation?
The devolution of decision-making to systems, to integrated care systems, will help to join up care, help to deliver care more effectively. And I think that that's one of the reasons why these proposals have been received so enthusiastically by the NHS themselves, by NHS colleagues, and including from local government, not least because the proposals originated from proposals from the NHS themselves. So I look forward to working with the Honourable Gentleman and would suggest that he works with his local NHS to make sure that this legislation goes through in the most high-quality way possible, that we have a high-quality debate around it so that it can serve his constituents in exactly the way that he sets out.
Video link, Ben Bradley.
Mr. Deputy Speaker, I know from conversations I've had with the health sector in Mansfield that much of this change will be widely welcomed, and joining up our services is vital if we're to have the best possible healthcare system. I just have one concern. The announcement also talks about new public health measures. There's an obesity strategy that I fear risks increasing inequality by raising the cost of the weekly shop. Surely education is the key to public health, teaching people to cook fresh meals, for example, as people need the skills to make healthier choices, or they just end up paying more. So can my right honourable friend ensure that public health elements of these reforms focus on that education and don't just end up hitting people in their pockets?
Yes, of course I'm alive to that concern, and I look forward to discussing these measures with my honourable friend further. The crisis has demonstrated how helping people achieve a healthy weight is important, and this is something that the Prime Minister has shown personal leadership in policy terms. Of course, more information and more education is an incredibly important part of this, because really it's about that shared responsibility, including personal responsibility, to improve public health. So I look forward to working with him on the details of it and making sure that we can get this into such a shape that it genuinely supports the improvement of and the tackling of obesity, but does it in a way that supports people as he sets out.
Video link. Lillian Greenwood.
Thank you, Mr. Deputy Speaker. A decade ago, the Minister and his colleagues opposite pushed through the Lansley reforms, even though NHS staff were warning us that they'd lead to fragmentation and waste. Why should we trust him now when he and his party got it so wrong then? How will he gain the trust and confidence of all NHS workers for his plans and for the timing of these reforms?
Mr. Deputy Speaker, the reforms that we've set out are reforms that themselves were initiated and generated from the NHS, and I think that is maybe one of the reasons why I'm so pleased to have seen such a strong positive reaction from the NHS itself to these proposals. They're about what happens over the decade to come. Of course, we always need to be improving the NHS, and each reform is a matter of the context of its times. What I'd say about these reforms is that they're about more innovation, more integration, and more accountability for the NHS, all with the goal of supporting those who work on the front line to deliver better care.
Video link. Lee Anderson.
Thank you, Mr. Deputy Speaker. COVID has changed the way we live and work. We've all had to adapt, and our NHS has been forced to find better ways of working. So can my right honourable friend please reassure me that our NHS will learn from our COVID days, adopt some of the new measures in place and improve its performance over the coming years, whilst delivering on our commitment to recruit 50,000 more nurses and build 40 new hospitals.
Absolutely. We are on track to hire 50,000 more nurses over this Parliament and to build 40 new hospitals over this decade. They are absolutely core commitments in our manifesto that he and I both stood on with great enthusiasm, and I look forward to delivering on those commitments. And the white paper will help towards that, but that is on track and underway already. He's quite right about learning from what's gone well in the pandemic, where the NHS has had to work so incredibly hard. The white paper will help to do that, but it's also critical that some of the culture and some of the ways of working, which has been more flexible, more dynamic, and more joined up within the NHS over this past year, embracing more modern technology than ever before. It's critical we keep pushing that culture forward and supporting people in driving that culture forward, and don't fall back to old ways of working. The white paper will help us to do that, but it's only one part, because it's really down to how everybody works as a team and works together, which is at the core of where things have gone well over the pandemic.
Video link. Imran Hussain.
Mr. Deputy Speaker, a year and a half ago, we halted the dangerous backdoor privatisation of key services in Bradford's hospitals whilst ministers sat on their hands and ignored the outcry of NHS staff and local people. And the proposals in the press confirm what I and many others have long said about the disaster and waste of privatisation in our NHS. Will the health sector will finally end the
Sorry, Imran.
circle, and that never again will there.
Yeah, Imran, it's a very, very bad line even on audio, but the Secretary of State is going to give a go at answering.
I can answer because the irony is that the changes that have been proposed that the Honourable Gentleman was concerned about, that were halted, were proposals that it is currently legally impossible for a minister to stop without going through a whole process that I know the Honourable Gentleman knows about. The proposals in this white paper would make it easier for us together to work collaboratively on the right outcome. And removes some of the bureaucracy that frankly stops ministers from getting involved when a project is not going in the right direction. So I hope that he therefore on that basis welcomes the white paper.
Sorry about the gremlins, Imran, but the Secretary of State did very well in answering your question. Gareth Davis, video link.
Thank you, Mr. Deputy Speaker. Can my right honourable friend assure my constituents in Grantham and Stamford that bringing health and social care much closer together will help provide a more efficient, higher quality service? And can he specifically outline how an integrated care model may help reduce demand for emergency services in Lincolnshire?
I very much hope so, because it's about being able to deliver services according to local need, but crucially not just looking at the patients who turn up, and whether that's to an emergency service or through their GP for treatment in secondary care, but about trying to get ahead of that and support people to stay healthy in the first place and bring the budget of the NHS to bear on keeping people healthy in the first place. That preventative agenda is absolutely critical and can ensure that not only people stay more healthy, but also that we spend money more wisely.
Video link. Dame Diana Johnson.
Thank you, Mr. Deputy Speaker. Having been in Parliament in 2010, I voted against the Tory Lib Dem coalition's flawed reorganisation, the failure of which has led us to today's announcement. Now, as well as sharing concerns about having another reorganisation during the pandemic, what guarantees can the Secretary of State give that these changes will improve the health of my constituents in Hull North, when under his plans, Hull will be lumped into an artificial hodgepodge of the humble Humber Coast and Vale ICS, a geographical area of 1,500 square miles with cities, market towns and remote rural and coastal communities with little transparency and no clear lines of accountability to local people in Hull, with our very stark health inequalities.
Improving the accountability of ICSs is absolutely at the heart of the white paper. You know, the three sections that I set out, one of which is accountability, to make sure that ICSs, as they get stronger powers and more statutory footing, also have the accountability that necessarily goes with that. There is a perfectly reasonable debate about the geography of ICSs, making sure they cover the right scale to be able to deliver services effectively and yet are also local enough to deliver for local people. That has been an ongoing discussion. The aim is to implement the measures set out in the white paper by April 2022, and at that time we'll need to make sure that those geographies are right. In very large part they are already. But if there is further work to do in any area, then I'm very happy to have a discussion about that.
Video link, Mary Robinson.
Thank you, Mr. Deputy Speaker. The demands of the pandemic on Stockport Council, GP services and my constituency hospital, Stepping Hill, have shown the benefits of joint working and data sharing to improve care and health outcomes. So I welcome today's announcement. We know that when bodies work together, people receive better care. Stockport Together's previous journey on this path highlighted the huge benefits of health and care working together, as well as the challenges of addressing silo working and the pressures of pooled budgets. So would my right honourable friend confirm that these proposals will deliver a more streamlined system which will give seamless care and healthier outcomes for my Cheadle residents?
Is exactly the goal, and exactly as my honourable friend sets out. And in particular, I'm glad that she raised data sharing as part of the integration, because it is absolutely critical that we have high quality data sharing where data is protected for the individual but also shared amongst those who need it for the purpose of joining up care. So you don't, when you go to hospital, have to give all of your details over and over and over again. So if you do go to hospital, your GP knows about it, so that care homes, for instance, GPs and hospitals can care better for an individual without having repeatedly to diagnose. This is a very, very important agenda for the NHS, which it should approach with confidence as a core part of joining up care.
Video link, Mohammed Yazin.
Thank you very much, Mr. Deputy Speaker. In my constituency of Bedford and Kempston, patients are being left in unimaginable pain as they struggle to access even emergency dental treatment. Dental practices are struggling to stay open with the impact of COVID on their businesses, and those that have survived are struggling to cope with the backlog. Imposing targets isn't working. So will the Secretary of State include oral health in his future plans and agree on sustainable funding solution with NHS dentists to end the crisis in oral health care?
Mr. Deputy Speaker, the crisis has been very tough on dentistry, and by the nature of dentistry, the infection prevention and control systems in place are a challenge. I look forward to working with the dentists to make sure that this sort of integration can help appropriately for them, and I'm very happy to arrange a meeting between the Honourable Gentleman and the Minister responsible for dentistry to discuss these concerns.
Video link, Robert Largan.
Thank you, Mr. Deputy Speaker. I welcome the proposals for more integration and collaboration between the NHS and social care. However, it is vital that these important reforms do not get in the way of investment in NHS capacity and the commitment to recruit 50,000 more nurses. Can the Health Secretary assure the House that they won't, and that the government remains committed to the badly needed new urgent care centres at Stepping Hill Hospital and Tameside Hospital?
Yes, absolutely. Stepping Hill Hospital is obviously absolutely vital to his constituents. The urgent care centres are important too, especially in ensuring people can have access to treatment closer to home for smaller but yet urgent problems. We also have introduced 111 first, so that people should call 111 before they go to an urgent treatment centre or indeed an A&E, to let them know that they're coming and to check that that is the right setting for them. So this is it's an important part of our wider considerations that will be helped by the measures in this white paper.
Video link, Dan Jarvis.
Thank you, Mr. Deputy Speaker. Shamefully, the poorer you are, the younger you will die. And that link between economic deprivation and health outcomes has meant that Barnsley is suffering one of the highest COVID mortality rates in England. Health inequality is an incredibly complex problem, but it is avoidable. So does the Secretary of State agree that a key test of these reforms is whether they will tackle this injustice?
I do. I think that tackling health inequalities is incredibly important. It's a vital part of our levelling up agenda. And he's right to point out the gaps in life expectancy across this country. And I hope that a move to a population health approach, where the focus of the whole local system is on improving the health of the population, not just treating those who ship up needing support, that can help us to tackle health inequalities as a society.
Tom Hunt.
Mr. Deputy Speaker, I think the key element of the statement today was it strengthens accountability to this House, which I very much welcome. Would my right honourable friend confirm with me that this will mean that as local members of Parliament we are better placed to represent our constituents in this place when it comes to communicating any concerns that they might have about unpopular local reorganisation of key services at their local hospital?
Yes, absolutely. It is important that whilst, of course, the NHS continues to evolve and must evolve, it is there to serve our constituents, and for a reform to take place, needs to make the argument for why that is better for our constituents. And ultimately, when such a large amount of taxpayers' money is spent on a public service, of course it is right that there is accountability for the services that are provided to ministers and through ministers to this House. That is the essence of a democracy, whilst preserving the clinical independence, for instance, over any individual decisions and over decisions, for instance, over the National Institute for Clinical Excellence and what drugs are appropriately advised. That is the settlement that is proposed in this white paper that I hope garners widespread support.
Video link, Margaret Greenwood.
Thank you, Mr. Deputy Speaker. Integrated care systems have their roots in accountable care organisations, such as are used in America, in which individuals take out private health insurance. It is therefore hardly surprising that there is a great deal of concern about the introduction of integrated care systems here. So can the Secretary of State give a cast-iron guarantee that he will legislate to ensure that NHS patient data cannot be used to promote or sell private health insurance or services to patients?
This isn't. I don't understand the logic of the Honourable Lady's question at all. I haven't seen those sorts of concerns that she raised about integrated care systems, which in the UK have provided the join-up of care that people have been looking for so long. I'm very happy to look at the details that she raises on the provision of data, but what I can tell her absolutely is that this is about NHS provision. It is not about the provision of healthcare through insurance, other than through the national insurance that we come together as a society to pay in order to provide healthcare free at the point of use. That is a belief that I hold dear, and I think is shared by the vast majority of this House and this country. And I'm very happy to reaffirm that and reassure her.
Video link, James Davis.
Thank you, Mr. Deputy Speaker.
As an officer of the APPG on obesity, I welcome this statement, particularly its promises relating to obesity policy, including limitations on unhealthy food advertising and new requirements for calorie information on food packaging. Will my right honourable friend outline the likely timescales for associated legislation, and in the interests of both fairness and efficacy, will he ensure that there's a level playing field between advertising via British television broadcasters and often overseas online services in terms of statutory extent and date of commencement?
Yes, these are very important measures. I'm glad that they have my honourable friend's support, not least with his extensive knowledge of this as a practising GP who's done so much during this crisis. And I think the whole House is grateful to his commitment and his work. In terms of timing of legislation, I'm unfortunately not permitted ahead of Her Majesty's next visit to the other place to be able to go into any further details, but the White Paper sets out reforms that we hope to have in place by April 2022, so I hope that he can take from that some indication of our sense of pace.
Video link. Debbie Abrahams.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, with one of the highest COVID death rates in the world and NHS workers under such incredible pressure at the moment, this is hardly the best time to be talking about yet another NHS reorganisation. In his response to me 2 weeks ago, the Prime Minister committed to addressing the key underlying causes of the high and unequal COVID death toll, primarily socioeconomic inequalities driven by 10 years of austerity. He said he would be implementing Professor Sir Michael Marmot's recommendations to build back fairer. So how will the proposals in the White Paper address these inequalities, their impact on declining life expectancy, as we've heard, and that we have, and how will they also address the highest excess mortality rate that we have in Europe?
Mr. Deputy Speaker, I gently would like to say that I disagree entirely with the Honourable Lady's pessimism about the ability of improvements to the health service to assist in the closing of health inequalities and the provision of care. As a Greater Manchester MP, she will understand better than most the benefits that come from that sort of integration. The idea that we should fail to act on what the NHS themselves have asked for because of the challenges they're facing is completely the wrong way round. I see it entirely the other way, which is it is incumbent on us to act in order to deliver the improvements that the NHS is calling for.
Video link. Andrew Lewer.
Thank you, Mr. Deputy Speaker. During the last Parliament, I sat on a joint health and housing, communities and local government committee, and this latter I'm now pleased to be rejoining. This commissioned a report on the future of adult care, which left open care insurance type options to spread the financial burden and so as not to create an ever larger NHS versus the critical local government role, but also crucially that choice and flexibility were enhanced for a 21st century care system. How will these aspirations fit into the plans that he's describing today?
The White Paper takes forward parts of those proposals to do with the integration between health and social care and ensuring that it is those on the ground delivering both health and social care who can decide the best way to provide that for their population. We are committed to take forward funding reforms as set out in our manifesto. Those funding reforms are not part of this bill, but the Prime Minister is committed to bring those forward this calendar year.
I'd like to thank the Secretary of State for his statement today and answering 30 questions in an hour and almost 10 minutes. So thank you very much for that. Point of order, Mr. Jim Shannon.
Mr. Deputy Speaker, the point of order is this. I noted that the petition calling on government to trigger Article 16 to allow unfettered trade within the United Kingdom has been signed by today 138,000 people. Mr. Deputy Speaker, these are people from every constituency in this great United Kingdom of Great Britain and Northern Ireland. and my own constituency of Strangford has the highest percentage of constituent signatories. Can you, Mr Deputy Speaker, confirm that this UK-wide demand upon government should be swiftly recognised in this House through a timely debate, and further that action to fill the shelves in Strangford and across Northern Ireland must be a priority, not simply for this MP, but for all MPs and therefore for this House? Thank you.
I'd like to thank the Honourable Member for his point of order and giving notice to the Chair that he was about to do so. As he knows, it's not for the Chair to schedule debates on petitions, and that is for the Petitions Committee, and they can also take other actions also. So I suggest that he contacts the Petitions Committee as soon as possible, and as an experienced member, he will know that there are other avenues by which he can raise the matter, as he has so skillfully demonstrated just now. We are going to suspend for 3 minutes. Order!